Hello, Pharmative friends, and welcome to Pharmative Live on Facebook Live. I'm Dr. James Partyka. I'm your host for Pharmative Live, and I welcome all of you here to this morning's presentation on hypertension guidelines. This is our opportunity to kind of interact and exchange ideas and information. So please feel free to send your questions to either info@pharmative.com or text your live questions right now on Facebook. Today we're going to be talking about the new hypertension guidelines. This is part 2. And in part 2 of reviewing hypertension guidelines with you today, we're going to focus on determining your cardiovascular risk by using a calculator that you can access through the internet. So let's just review briefly what we discussed a few weeks ago regarding hypertension. The 2017 guidelines by ACC and HAA, you can get your copy by going to this link at acc.org, is very comprehensive in the detection and prevention of blood pressure, high blood pressure, monitoring and treatment. As you all know, that oftentimes hypertension is asymptomatic. But if you are experiencing symptoms like blurred vision, dizziness, headache, and a number of others, that may be an indication that your blood pressure is high. Oftentimes, though, high blood pressure is asymptomatic, and it's important to treat high blood pressure because it reduces your incidence of and your risk of cardiovascular disease as well as stroke. And in the new guidelines, and before I go over the new recommendations, I just want to point out that in approximately 10% of patients with hypertension, high blood pressure, there may be an actual cause that needs to be corrected first. An example of this would be if you have a hormone disease like Cushing's syndrome, or perhaps a vascular problem associated with your renal arteries. So renal artery stenosis is where the vessel is actually constricted slightly. Those things can be corrected and should be corrected first. But in about 90% of patients who present with high blood pressure, there's no specific cause determined. And so therefore, we're going to follow these 2017 guidelines and recommendations for treating the blood pressure. So last time we reviewed the classes normal is less than 120 and elevated is 120 to 129 and less than 80. And again, these are stricter in these guidelines, stricter parameters for defining what high blood pressure is. So take note of that. And then stage 1 would be if your systolic blood pressure is 130 to 139 or 80 to 89. That's classified as stage 1. And stage 2 is greater than or equal to 140 or greater than or equal to 90. Now, if you fall in stage 1, the next step is to calculate your 10-year cardiovascular disease risk score or risk assessment score and determine if it's less than 10% or greater than or equal to 10%. And on the next slide, I'm going to show you the formula, which is easy to do online and something to discuss with your healthcare team, your doctors and your nurses and pharmacists to see whether you're a candidate or not for medication treatment. So that's what this score is going to do. If it's less than 10%, then we're talking about lifestyle changes, changes in your diet, more exercise. If you need to lose weight, and greater than or equal to 10% or more, then we're going to evaluate you as a candidate for medication. And antihypertensive medications have been demonstrated, depending upon the class of agent, to reduce the risk of cardiovascular events, heart disease, or stroke. That's why it's important for us to be able to maintain your blood pressure within the normal range of less than 120 or less than 80 for your diastolic blood pressure, okay? So we're gonna go to the next slide. And here it is. If you go to this website, cvriskcalculator.com, this will be a very user-friendly calculator to estimate what your risk of developing cardiovascular disease or stroke within the next 10 years. And all you need is a few bits of information. You plug it in the calculator online and it'll calculate your risk score for you, which you can discuss with your physician and your nurses and your pharmacist on whether you're a candidate for treatment or not. So this is for people that are ages 40 to 79. That's the calculator is intended to use for adults between these ages. You're going to enter your current blood pressure, your race, what your total cholesterol level is, what your HDL level is. Are you currently treated with medication, whether or not you're a diabetic or a smoker? You enter that information, which I did a few weeks ago, and it actually then calculates your risk. And say, for example, your risk score comes out 9%. 9% would indicate that in the next 10 years, you have a 9% risk of a cardiovascular event, for example, like a heart attack or stroke within 10 years. If your cardiovascular risk assessment score came back at 12%, then that risk would be, you have a 12% chance in the next 10 years of having a cardiovascular event or stroke. That's why it's important to determine whether or not you're a candidate for appropriate medication. If the score is 10% or higher, you're a candidate for medication, and you should discuss this with your doctor. And if it's less than 10%, then you're just going to monitor closely and then reassess in a few months. That's all it is. Now, you may not have these two values with you, your total cholesterol and your HDL level. That would have been a blood test that you may have done either at home or in a lab facility. And if you don't have those two numbers, you want to, next time you go see your healthcare practice, your clinic, you want to ask them for that data, and they'll probably calculate your cardiovascular risk score with you at your next visit. Again, it's very important that we review what the guidelines are. If you've been diagnosed in the past with hypertension and are currently on medication, it's always a good idea to bring up the new guidelines and ask your doctor if you're a candidate for a different class of medications, a class of medication which has been associated with a reduction in mortality and morbidity, and reevaluating whether you're a candidate for a newer agent or combination therapy. So again, it's important to know what your score is. It's important to have your blood pressure monitored on a regular basis. And remember, hypertension is an important medical disease that we need to monitor closely and treat when it's appropriate. So I'm just going to conclude with the previous slide and just go right back over. Again, if you fall between these parameters, 130 to 139 of systolic blood pressure, 80 to 89 of diastolic pressure, and you determine that your cardiovascular disease risk score is greater than or equal to 10%, then you're a candidate for medication. And then if you're stage 2 hypertension, you're a candidate for medication and 2 different classes of medications in order to control your blood pressure to make sure that you're at the lowest risk possible for developing cardiovascular disease or stroke. So that's everything today on hypertension and calculating your cardiovascular risk. That's all for today. I'll see you next week. And in the meantime, stay healthy.